Hello, I'm Erin Maestrado, a student nurse from University of St. Anthony. So today, I'm going to demonstrate the monitoring and measuring the input and output worksheet. So what is intake? Intake includes all the food and fluids that are liquid at room temperature, such as parental fluids and other fluid into the body. Also, it refers to all the fluids taken by the patient. While output includes all urine, bile, vomitus, diarrhea, perspiration, and drainage from suctioning devices, blood loss, and other fluid that came out of the body. So, also it refers to all the fluids eliminated by the patient. So, these are the indication. First, illness that cause alteration in fluid balance. Secondly, it is usually advised when a fluid imbalance exit to the client is at risk. So this is the things we should nurses consider. First, compare the weight of the clean product with the soiled product. And then notify the doctor if early urine output is less than 30 ml in adult, or if the client refuses any more fluid intake, infusion, and drainage devices. Also, watch out for fluid restriction order and use gloves when handling body fluids. So this is the contradiction. First, client has consistent adequate intake and output. Secondly, normal daily intake and output for adults which is 2,500 to 3,000 ml. Lastly, we nurses should alert the doctor if rapid gain or more than 2 pounds per day, and if new onset of severe pulmonary difficulty of respiration rate of 30 cycles per minute, and urine output is 30 ml per hour or 2 or more consecutive hours. Lastly, alert the doctor if patient changes in mental status. So this is my 24 hours intake and output monitoring sheet. So we have the name, room or the ward number, and the doctor. So next we have the intake and output. I use the three different colors of ball pen because of some purposes. So first, the date which is September 9, 2021. Next, the time which is 7 a.m. to 3 p.m. So I used black ball pen for 7 a.m. to 3 p.m. And next one is the oral. I compute all the oral intake for 7 a.m. to 3 p.m. so that the total oral intake is 1,400 cc or ml. Next is no IV intake, and in others, for example, the patient intake antibiotic, so we should put it here in others. Next is the total intake. The total intake for 7 a.m. to 3 p.m. is 1,420 cc or ml. Next one, for the output from 7 a.m. to 3 p.m. So here in output, we have the urine. I compute the total output for 7 a.m. to 3 p.m., which is 430 cc or ml. And next is emesis or vomitus. For example, if the patient vomited, it should put it in here. And next, the drainage. For example, the patient undergo to cholecystectomy. Next, the stool. We need to count the frequency. So I write 1 times. So for the total output for 7 a.m. to 3 p.m. is 430 cc or ml. Next, for the 3 p.m. and 3 p.m. to 11 p.m., I used red ball pen, and the total oral intake is 700 cc or ml. And also, this is now the total oral intake for 3 p.m. to 11 p.m. Next one, the output for 3 p.m. to 11 p.m. is 500 cc, and also this is the total for 3 p.m. to 11 p.m. output. Lastly, for
11 p.m. to 7 a.m., I used blue ball pen, and the total oral intake for this is 450 cc or ml. And also this is how the total oral intake for 11 p.m. to 7 a.m. Next, for the output in urine, 200 cc is the total output. So all in all, the 24 hours grand total intake is 2,520 ml, and also the 24 hours grand total output is 1,140 ml.